There's something oddly revealing about the way people react when a healthcare system changes a form, not a hospital closure, not a national scandal, just a prescription update. And yet suddenly thousands of older people are on the phone to pharmacies, sitting in GP waiting rooms, refreshing government websites, asking the same quiet question: what exactly is happening? Because the thing about systems like the NHS is that most people don't think about them very much. Until something changes, until a letter arrives that looks unfamiliar, until a prescription that used to cost one thing now appears to cost another, until someone behind a pharmacy counter says, actually, the rules have changed. And I think what's interesting is that this latest NHS prescription update, the one now confusing so many seniors across the country, isn't really about prescriptions at all. It's about trust, routine, and the strange fragility of certainty. For years, many older people in Britain have built their lives around predictable systems. The bus pass arrives, the pension comes through, prescriptions are sorted, it becomes part of the architecture of everyday life, quiet systems operating in the background so people can simply get on with living. And when one of those systems suddenly becomes unclear, even briefly, the emotional reaction can feel surprisingly large, because confusion, particularly later in life, carries a different emotional weight. You can almost feel it in the conversations happening now. People standing at chemists asking whether they still qualify, adult children trying to explain online NHS forms to parents who have never really used email, pensioners genuinely worrying that they've accidentally done something wrong, not because the issue itself is catastrophic, but because uncertainty has become exhausting. And honestly, I keep coming back to that. Because this story arrives at a moment where many people, especially older people, already feel slightly destabilized by the pace of modern public life. Everything is digitized, automated, updated, revised, password protected, QR coded, terms and conditions accepted somewhere deep inside a touchscreen menu nobody fully reads. And the NHS historically was one of the last places that still felt human scale. You rang your GP, you picked up your prescription, you spoke to somebody, simple things, important things. Now, of course, there are practical reasons these systems evolve. Officials talk about efficiency, fraud prevention, modernization, cost pressures, and to be fair, the NHS is operating under extraordinary strain: an aging population, staff shortages, financial pressure, political scrutiny, all of it layered on top of each other year after year. So from a policy perspective, changes to prescription systems can sound entirely rational, but policy decisions rarely land emotionally the way they sound administratively. That's the gap governments often underestimate. Because what feels like a minor update inside Whitehall can feel deeply personal to someone standing confused at a pharmacy counter wondering whether they can afford the medication they've taken for 20 years, and maybe that's the point. The conversation seems to be shifting towards something bigger now, not simply whether this NHS update was communicated properly, but whether modern Britain still understands how vulnerable confusion itself can be, particularly for older citizens. We talk a great deal about financial vulnerability, medical vulnerability, physical vulnerability, but informational vulnerability is becoming its own quiet crisis. The inability to navigate systems that increasingly assume digital confidence, the exhaustion of constantly adapting, the subtle humiliation some people feel asking for help with forms they don't understand. And what's striking is that many seniors won't even complain loudly about it. That generation often doesn't. Instead, they apologize, they blame themselves. They say things like, "I'm probably being silly," when actually, the system may simply not be speaking clearly enough. Now, to be fair, there are people who argue this reaction is overblown, that every large public system requires updates, that confusion happens temporarily whenever procedures change, and they're not entirely wrong. There's also a broader debate happening around NHS sustainability. Prescription costs matter, administrative waste matters. Governments are trying to manage an institution under enormous pressure while balancing budgets that already feel politically combustible. So there's a legitimate argument that reform, however uncomfortable, is unavoidable. But what's interesting is how quickly practical discussions become emotional ones when healthcare is involved, because healthcare isn't experienced abstractly. It's experienced in kitchens, in medicine cabinets, in quiet moments at breakfast tables where people count tablets into their hands and wonder whether they'll still be able to access them next month. That's where policy becomes real. And I think politicians sometimes forget that the NHS occupies an almost psychological role in British life. It's not merely a service people use, it's tied to identity, stability, fairness, the idea that whatever happens politically or economically, there remains at least one institution that will still catch you when you're vulnerable. So when communication around it feels chaotic or unclear, people react emotionally because it unsettles something deeper than administration. it unsettles confidence. There's this growing feeling that many institutions now communicate in ways ordinary people no longer fully understand: dense announcements, technical wording, websites replacing conversations, systems assuming everyone moves at the same digital speed, and older people often feel that first, not because they're incapable, but because the culture around public services has changed faster than many people's lives have. It's strange because Britain talks constantly about respecting older generations. We celebrate them symbolically. We praise resilience and sacrifice and wartime spirit. But respect in practical terms sometimes looks like something very simple: clear communication, patience, time, human explanation. Not everyone has family members available to decode policy updates. Not everyone can navigate helplines that keep redirecting callers through automated menus. Not everyone understands why something that worked perfectly well last year suddenly requires a new process. And honestly, beneath all of this, I think there's a deeper societal anxiety emerging. A fear that everyday life is becoming administratively harder at precisely the moment many people need simplicity most. The forms get longer, the systems become more digital, the explanations become less human, and slowly people begin feeling left behind inside their own country, not dramatically, quietly, which is often how social trust erodes. Not through one enormous collapse, but through hundreds of small moments where people feel confused, unheard, or slightly embarrassed asking for help. And maybe this NHS prescription confusion will eventually be resolved. Maybe clearer guidance arrives, maybe pharmacies adapt, maybe the panic fades within weeks. But I suspect the reason this story resonates so deeply is because people recognize themselves in it. Not just seniors, anyone who has stared at a government website feeling strangely overwhelmed, anyone who has worried they misunderstood something important, anyone who has felt the modern world speeding up just slightly beyond comfortable comprehension. Because in the end, this isn't only a story about prescriptions. It's about what happens when institutions stop feeling understandable, and whether modern public life still leaves enough room for people to feel secure inside the systems designed to protect them.